We live in an age where a capsule can feel like a promise of calm nerves, better sleep, stronger bones, and magnesium has quietly earned the reputation of being harmless, even virtuous. Yet biology has never respected our assumptions, and the human body never responds to shortcuts without consequence. When we look closely with scientific humility and curiosity, magnesium supplements reveal subtle risks that are rarely discussed, not because they are dramatic, but because they unfold slowly, invisibly, at the level of cells, enzymes, and delicate physiological balances that keep us alive. Magnesium is essential, yes, but essential does not mean unlimited, and nature has always demanded precision more than excess. Magnesium never works in isolation inside the human body. It enters a living system governed by balance, competition, and constant negotiation between minerals that share the same biological space. Calcium, potassium, sodium, and magnesium communicate through electrical charges, shaping nerve impulses, muscle contractions, and heart rhythms moment by moment. When magnesium is consumed in excess through supplements, it can quietly tilt this balance, not dramatically enough to trigger alarm, but subtly enough to alter how cells behave. Elevated magnesium levels can suppress calcium activity, weakening muscle contraction and dulling nerve transmission, which may be felt as unexplained fatigue, heaviness in the limbs, or reduced physical endurance. At the same time, magnesium influences potassium movement across cell membranes, and even slight disruptions can affect how the heart's electrical system fires, creating sensations such as palpitations, skipped beats, or internal restlessness that often go medically unexplained. From a physiological perspective, the body evolved to absorb magnesium slowly from food, accompanied by fiber, amino acids, and trace minerals that moderate its entry into the bloodstream. Supplements bypass this evolutionary pacing, delivering concentrated doses that flood mineral channels faster than the regulatory systems were designed to handle. Over time, this can recalibrate neuromuscular signaling, making nerves less responsive and muscles slower to react, a state that mimics aging or chronic stress rather than acute toxicity. What makes this danger difficult to recognize is its ambiguity. Symptoms do not feel like poisoning, they feel like just not feeling right, a vague decline in vitality that is often attributed to lifestyle or workload. At the cellular level, enzymes that depend on precise mineral ratios begin to lose efficiency. Energy production becomes less coordinated, and the nervous system shifts away from resilience toward fragility. Not because magnesium is harmful, but because biology values proportion more than abundance. The digestive system is often the first environment to register the quiet stress of excessive magnesium supplementation, because the gut is not merely a tube for absorption, but a living interface between the outside world and the internal economy of the body. Magnesium, especially in supplemental forms such as oxide or citrate, exerts an osmotic pull within the intestines, drawing water into the bowel and accelerating movement in a way that can seem beneficial at first. Over time, however, this constant stimulation can shift normal gut rhythms, leading to persistent looseness, urgency, or discomfort that is dismissed as sensitivity rather than imbalance. What appears to be mild digestive upset is actually a signal that the intestinal environment is being pushed beyond its adaptive range. As magnesium speeds intestinal transit, it reduces the contact time required for proper absorption of other nutrients, including iron, zinc, calcium, and fat-soluble vitamins. This creates a paradox, where someone supplementing for health may slowly develop deficiencies, not from lack of intake, but from impaired uptake. The intestinal lining, exposed repeatedly to high concentrations of unabsorbed magnesium, can become irritated at a microscopic level, altering the integrity of tight junctions and subtly weakening the gut barrier. This does not announce itself dramatically, but it can contribute to bloating, food sensitivities, and low-grade inflammation that erodes digestive resilience over months or years. From a biological standpoint, the gut microbiome is also affected. Changes in mineral concentration and water balance can shift bacterial populations, favoring species that thrive in faster transit environments while suppressing those involved in fermentation, short-chain fatty acid production, and immune modulation. The result is not a single symptom, but a gradual loss of digestive efficiency and metabolic harmony. Magnesium from whole foods arrives diluted, buffered by fiber and phytonutrients. allowing the gut to remain an intelligent regulator rather than a forced conduit, reminding us that digestive health depends not on stimulation, but on respectful cooperation with the body's natural pacing. The kidneys are among the most quietly intelligent organs in the human body, filtering blood continuously and making thousands of microadjustments each day to maintain mineral balance without conscious awareness. Under normal conditions, they regulate magnesium with remarkable precision, excreting excess amounts while conserving what is needed. Problems arise when supplementation delivers magnesium in concentrations that exceed the kidney's adaptive comfort zone, especially when this intake is sustained over time. In individuals with reduced kidney efficiency, which can occur gradually with aging, dehydration, diabetes, or mild hypertension, magnesium clearance becomes less reliable, allowing levels to rise subtly in the bloodstream without triggering immediate warning signs. As magnesium accumulates, its physiological effects begin to influence systems far beyond the kidneys themselves. Elevated blood magnesium can relax blood vessels excessively, leading to unexplained drops in blood pressure, lightheadedness, or a sense of physical heaviness that feels more like low energy than illness. Reflexes may slow as neuromuscular transmission becomes dampened, and the heart, which relies on finely tuned electrical signals, may respond with rhythm irregularities that are difficult to trace back to mineral overload. Because these changes develop gradually, they are often attributed to stress, aging, or fatigue rather than renal mineral handling. What makes this risk particularly overlooked is that kidney strain does not require diagnosed kidney disease. Many people live with mildly reduced filtration capacity and feel entirely normal, assuming supplementation is safe because it is widely available. Unlike dietary magnesium, which arrives in modest amounts and is spread throughout meals, supplemental magnesium presents the kidneys with concentrated doses that must be processed rapidly. Over time, this repeated demand can push renal regulation toward inefficiency, creating a feedback loop where accumulation further impairs clearance. The body is not rejecting magnesium. It is signaling that regulation has limits, and when those limits are ignored, even essential minerals can shift from support to burden within the silent architecture of renal function. One of the most underestimated risks of magnesium supplementation lies in its quiet ability to interfere with medications, not through dramatic side effects, but through subtle biochemical interactions that unfold at the level of absorption and transport. Magnesium carries a positive charge that allows it to bind with certain drugs in the digestive tract, forming complexes that the body cannot easily absorb. Antibiotics, such as tetracyclines and fluoroquinolones, are particularly vulnerable to this interaction, as magnesium can significantly reduce their bioavailability, weakening their therapeutic effect while giving the illusion that the medication has been taken correctly. The danger here is not immediate discomfort, but delayed recovery and persistent infection without a clear explanation. Beyond antibiotics, magnesium can alter the effectiveness of medications designed to manage chronic conditions. In individuals taking blood pressure medications, supplemental magnesium may amplify leading to unexpected drops in blood pressure that manifest as dizziness, fatigue, or faintness rather than a clear adverse reaction. For those using bisphosphonates to protect bone density, magnesium can interfere with absorption when taken too closely, undermining long-term skeletal protection while appearing biologically harmless. Even medications for thyroid function or heart rhythm can be indirectly affected as magnesium shifts. Electrolyte balance and gastrointestinal transit time. What makes these interactions particularly dangerous is their invisibility. Blood tests may appear normal, prescriptions are taken as directed, yet outcomes quietly deteriorate. Patients may be labeled non-responsive or may have dosages increased unnecessarily, compounding the problem rather than resolving it. The root issue is not toxicity, but timing, form, and context, factors rarely emphasized in casual supplement use. Whole foods rich in magnesium integrate naturally into digestion and rarely reach concentrations capable of disrupting drug absorption, whereas supplements compress large doses into a narrow window that collides with pharmacology. In this way, magnesium becomes a variable introduced into a system already carefully calibrated, reminding us that the body does not separate supplements and medications into different categories, but processes them together within the same biochemical reality, where interference is not dramatic, only quietly consequential. Perhaps the most subtle danger of magnesium supplementation is not physiological but psychological, rooted in how easily a pill can replace awareness. When health is reduced to a daily capsule, attention shifts away from the body's deeper signals, and nourishment becomes something added rather than something lived. Magnesium, framed as a universal solution for stress, sleep, or fatigue, can create the illusion that balance is being restored even while underlying causes remain untouched. The nervous system may still be overstimulated, sleep rhythms still misaligned, and dietary patterns still deficient in complexity. Yet, the presence of a supplement offers reassurance that something proactive has been done. From a biological perspective, magnesium obtained from whole foods behaves differently than isolated supplementation. It arrives alongside fiber, amino acids, polyphenols, and trace minerals that influence absorption speed, tissue distribution, and cellular utilization. This context teaches the body how to regulate intake naturally, while supplements remove that lesson and deliver magnesium in isolation. Over time, reliance on this shortcut can dull nutritional literacy, reducing curiosity about food quality, meal timing, hydration, and stress physiology. The body adapts not only to nutrients but to behaviors, and repeated reliance on supplements trains the mind to seek external fixes rather than internal coherence. There is also a motivational shift that occurs quietly. When symptoms are muted by supplementation, the urgency to correct sleep debt, chronic tension, or sedentary habits weakens. Magnesium may soften the consequences without addressing the cause, allowing imbalance to persist beneath a layer of biochemical comfort. This creates a fragile form of health, one that depends on continued supplementation rather than resilience. In contrast, magnesium from leafy greens, nuts, seeds, and whole grains reinforces rhythms of eating, digestion, and metabolic signaling that support long-term regulation. The risk is not that supplements fail, but that they succeed just enough to distract us from the deeper work of listening to the body, where real equilibrium is cultivated through consistency, environment, and respect for the slow intelligence of human physiology.